Vicky and I'm going to be doing a Foley catheter Passoff. Okay, so hi, my name is Valerie and I'm going to be your nurse today. So today we're going to be putting in a urinary catheter for you. You've just been having some trouble emptying your bladder. So yeah, so the first thing I'm going to do is make sure I have adequate lighting for the procedure, which I do. I'm going to do hand hygiene. I'm going to ask, do you have any allergies? Do you have any allergies to iodine or latex? Yeah. No? None? Okay. So I checked the medical record. We have an order for this. I'm going to check his patient ID. Will you say your full name for me and your birthday? So the medical number and his number on here match up. So everything's good. So the first thing we're going to do is pericare. I'm actually going to put gloves on. But then, these are non-sterile gloves. Maybe not. Okay. But then, I'm going to get him all uncovered. I would normally put him in a dorsal recumbent position, but this mannequin does not move very well. So we're just going to kind of open his legs up. And I provided privacy and everything for him, so we're not just flashing him to someone. So, here's this. He's all ready. Are you comfortable? Are you okay? Yes? Perfect. Okay, so the first thing I'm going to do is get these legs ready. You don't have to fight with them, we're going to do that. Okay. So, I'm going to grab here, I'm going to go around the end and just go in a circular motion. And I would use a different swipe every time or a new wipe every time. And we'll just use a new wipe. We're going to go down a little further. Okay, maybe. I also do have an assistant helping me. She's over there. She's very kindly. But she is mostly watching me for my sterile technique, and she's going to help me do this. We're just going to take this entire thing, because why not? This goes around, and then we're going to use a new place, and we're going to go all around. We're also going to use another place and go down to the rectum. And we're going to throw this. These are done. We're going to remove these. Do hand hygiene. Okay. And I do have all my supplies here, obviously, because I've been doing this. Okay, now it's time for sterile technique. So I'm going to be using sterile technique for this procedure. So I don't want you like putting your hands down there or trying to move your legs around too much. Just try to be really still and really calm during this procedure. I'll talk you through it as we go. Okay. Maybe. Okay, I'm going to open it away from me. Maybe get this all out. I'm going to throw this away because it's really annoying me. Okay, and then I'm going to set this over here. And then I'm done. Okay, so we're going to open this away from me. I'm remembering my 1-inch border, 2-inch border, something like that. Open this as well. And I'm just going to try to make sure these are straight. Only go on that border. And this has a little folder here. And I'm just going to try to get it as straight as possible on every side without going over my sterile field because it's not good. Alrighty, so the first thing I'm going to do, I'm going to get these gloves out without touching anything else. And I'm going to bring these gloves over here so that's easier for me to put on. I have my sterile field right here, so I'm not turning my back to it. Okay, I'm going to open these, and then open, 2 seconds. Open this. I have one before in here, so, oh my gosh, these folds get me every time. Okay. Fold down one way or another. This doesn't really have a touch. Okay. I have a little bit of a border in here. So just really do that. Aha. Okay. I messed that one up, so we're definitely gonna put this one on first. I'm just gonna be touching the inside of the cuff, keeping sterile filled. Getting my fingers in there slowly. Okay, now I'm going to grab this one. I'm going to splay it out easier. That totally went on the edge of the sterile field. If that would happen, I would get new gloves. So I'm going to grab the inside of here. And pull this on. Okay, I'm going to make sure I keep my hands up, not get too close to touch anything. Okay, so the first thing I'm going to do is I'm going to get my little thing out. I did this a little different. So I'm going to get right here, I'm going to go down, and without touching anything, I'm going to slowly pull this down. And I'm just going to make sure not to touch his skin, not to touch my skin, keeping the field sterile. And then I'm going to put this little one around it, keep it extra sterile. Okay. This way. I don't think it matters. And we're gonna just drop it. And then just push down a little without touching his skin again. Okay, I'm gonna set everything up over here, and then I'm gonna bring my box over there to make it a little easier for me. Okay, I'm gonna open this up. These, and when I drop anything in the garbage, I'm gonna drop it from up here. Just let it float down. I'm gonna get these all ready for me so that I have an easier time. This is all sterile. All sterile, remembering my border, not to touch anything. Okay, I'm gonna get everything all ready. This would be what I put my specimen, like my hearing specimen or whatever you want to call them there. But, okay, I am going to firstly get this that's still in there, and get my sterile syringe. Keep my hands above sterile here. And then I'm just gonna get this connected on there for me to make it easier. Okay, with this, I'm gonna slowly, very slowly pull down and make sure that this stays sterile and it's not going everywhere. Drop this. I'm gonna get my lubricant ready. I can find what side. It's right here. We'll try it. Might not be. Nope. Oh, it literally says tear right there. Anyhow. Then we're gonna go, I like to put it, let's see, get it in the lubricant and leave it in the lubricant. Okay, I'm gonna make sure everything, maybe, it's being a heater right now, stays in the box when I move it over here. Okay, I'm gonna touch the box, go right here, and without touching anything else, slightly drop the box down, keeping everything in the sterile box. I'm gonna get this and we're gonna start. Make sure I get these all set up as easy as possible for me. Okay, so I'm gonna grab right here and I'm gonna first start by cleaning around. Only doing one swipe. Drop. Another one. Clean a little bit lower. Drop it, and then one more. And we're gonna go right there. And drop it. This hand is now not sterile anymore. I'm going to move this out of the way as well, just for my success. Okay, so I'm gonna take this out of the lubricant, and I'm going to put it in about until I see a flash of urine. 1, 2, 3, take a deep breath. Okay, a flash of urine, and then I'm gonna continue advancing it. And I definitely touched his skin right there, which would be not sterile, so don't touch his skin, but I'm gonna continue with this. Okay, now my non-sterile hand, I'm gonna go over here, and right here it says to put 5 ml, and this is a 12. So I am going to push not strong with this hand. Okay. Don't let this burn, you guys. Okay, that is 5. Now this is no longer sterile. Everything is good. So this might spray. Yep, okay. And then I'm gonna get this out. I'm gonna put this over here. Okay, so if I wanna clean your sample, I'm totally gonna, before I do any of that, take these gloves off and put clean ones on. And hygiene. Clean gloves. Okay. Okay. Now I am going to make sure that this is closed on the catheter bag. This little thing, which it is. Put it back in there. I'm gonna put this on a non-movable part of the bed to make it comfortable for him. I'm gonna rip this off and move all of this. And then I'm gonna cover him up. And everything. I will put, probably gonna go back and do this. I'm gonna put the catheter up, secure on there because you need to secure it to your leg. So we're just gonna expose you one more time. So what you would do with these is you open it, secure it to this part of their leg. Try to put it a little bit lower down, and you're gonna have a little bit of You want it to be a little looser because you do not want it pulling on their leg the entire time. So that is there. Now we're gonna cover him up and do that. I'm gonna do hand hygiene. I'm going to put my name, date, and the insertion date on here. And this is on the unmovable part of the bed. Everything's good now. I think that I'm just gonna teach you about the best way to deal with your catheter. So these can be super uncomfortable, but the best way to keep them as comfortable as possible is to make sure you minimize the pulling on the catheter. Make sure there's no kinks or anything, so your urine doesn't build up and go back into your bladder, which could cause infection. Try to keep these really clean. Make sure your hands are all washed before you touch them. We will come around and clean them at least once or twice through our shift and empty it. If you have any problems, itching, burning, let me know. Push your call light. And I think we are all good. Thank you.